You have photos.
Yes, I do.
What'd you bring? What'd you bring?
Well, I actually, well, I'll start with this gentleman here.
Okay. Oh my goodness.
And this guy's he's actually in his upper 30s. He's a handsome guy.
That's a 30-year-old.
That's a 30-year-old. Well, this gentleman, he came to me. He actually came from Phoenix, and he's just had tremendous dental issues. He's hated to show his teeth. He never smiled at all. His wife actually brought him because he had been complaining to her, but no one else about.
Is that common, by the way, to see that?
Well, you don't see that, but I see it all the time. The patients, don't smile. They walk around. They hold their. Okay. They just sit. They don't show their teeth when they know that it looks like that.
You look at this. What has to be done?
Well, he had many problems with his teeth, but his upper teeth, he had gum disease. He was sensitive to hot and cold. He had decay.
So they all had to go.
For him, we extracted teeth, and he could have had dentures. But at his young age, and actually, as you know, anyone, I don't want to have dentures. This gentleman, we took him, and we decided to place implants, and we made teeth that stay in his mouth and don't come out, and we put them in the same day.
Okay.
And I think it's just remarkable, the change in what he looks like now.
Let's take a look. Oh, my goodness.
And now you can see what he looks like now.
You can see he is a young guy. Okay, so those are all, that's implants.
We placed 4 dental implants, and we were able to screw teeth in that stayed in his mouth the same day. And in fact, when he came out after doing it the whole day, his wife looked at him, she started to cry.
Really?
And she was just beside herself because, she knew for so many years he would not smile. He wanted to change his whole looks and smile, and this did it. But more important than smile, he can eat anything. He went home that day and was able to start to eat, to function, and to do things he hadn't done in years.
Are there a lot of guys like that, by the way? I mean, in Arizona, would you say that there's thousands of these people?
Well, at least thousands. I mean, I don't know the exact numbers, but there's so many people in not just Arizona, in the whole United States, millions of people that have a similar type of problem. So let me show you another case.
All right.
This lady here.
Okay.
And she came to me, and she was sent to me for dentures, and she actually was told you can't save anything.
So the general dentist sent her to you for dentures. Interesting.
The general dentist sent her to me for dentures. Let me show you a closer look at her teeth.
Oh boy!
And these teeth were really they looked terrible. They were moving. They were out. There were spaces. But when I saw her, I said, I can actually fix all your teeth if you like. And we went through it. She was prepared just for dentures. But with just a few dental implants, some crowns, and keeping all her teeth, we totally restored her smile.
Now, was this a woman then?
And wait till you see how she looks.
When they come in with smiles like this, is it tough for you to even get them to smile? I mean, are they ashamed or embarrassed?
Oh, I know. My first pictures normally are terrible. In fact, when they first get the teeth, I like taking pictures a year later because then they're relaxed. But when I first take a shot they don't want to show them at all. They hate having me take their picture.
Okay.
They look at me and they're like, you're going to take my picture? No one takes my picture.
Is that right? Is that right?
They hate.
Okay, so
picture.
for her, what'd you do? So you did.
Well, for her, we actually took here you can see her smile.
Oh my goodness.
We did implants. We did crowns. We totally restored, opened her bite.
Wow. And
now you can see she has all her teeth now. They don't come out at all. She can eat anything. She feels confident. And what's really neat is she becomes a great dental patient. Here's someone that hated going to the dentist. That's how she got that way. Now she loves coming into the dental office. She's not fearful. She doesn't have any problem seeing us again. In fact, we become really good friends. She's a wonderful lady.
So they start brushing and flossing and
they do all the things.
Like a second chance.
They do all the things they should have done years ago. They start to take care of it and really care about their mouth.
It's very interesting. It sounds like an exaggerated story almost. Somebody sent to you for dentures, and now she's got.
No, this is common. We see people like this all the time.
And now she's got a.
And actually, that's the most exciting part of my job, is that when I see people and I can immediately they sit down, I can tell how I can change their life and transform them into a whole new person by changing your smile, by changing your ability to eat and function and have. And have comfort again.
Are you ever surprised, by the way, with the transformation?
Well,
giving some of these teeth back does.
I think I'm excited by what we can do, and it's always.
I mean,
I'm very proud also that what we can do for people to help them today. It's really moving, and many of the patients give you big hugs the minute they get their new teeth and realize what a major change it is in their lives.
And